our Series 3, Week 4 of the African CDC webinar of Community of Practice. I just want to introduce you to the housekeeping rules. If all of you can please keep your video and your sound off, and then also please post all your questions and answers for the answers in the Q&A box and not in the chat box. Also, if you can just remember to have downloaded the Social app, so that you will be able to scan the QR code. I'm going to share the QR code with you now again, so that you can just scan that and start with that as well. It's also been streaming live on Facebook. So if you can't manage it at the moment, you can also watch on the Facebook. So here's your start code. If you've downloaded the Social app, please open the app and press the middle button. It will ask you to scan the code. Just keep it over the code and it will allow you to scan the code. At the end, we will display the closing or the end code as well, and then you'll be able to get your attestation. I'm just going to give you a minute or two to just scan the code. Remember, if you're using your phone for the webinar, it's going to be difficult. So just download it and keep it so you can scan it afterwards as well. It will still be available. Thank you. I'm just going to give you a minute to just scan. It is also posted on the Telegram Community of Practice. So if you want to use it afterwards as well to scan it from there, it is available on the Community of Practice as well. Okay, I'm going to just stop sharing, and then I'm going to introduce you to Dr. Patrick Kwabe from Africa CDC, who's going to do the introduction on the status of COVID in Africa. Over to you, Patrick. Thank you.
Thank you, Anne, and good morning, good afternoon, colleagues from wherever you are. Let me just share my screen. Okay. Okay. Can we all see my screen?
Yes, we can.
Okay, thank you so much. Okay, so I'll take you through, okay, thank you. So we'll take you through the updates as it stands, 2nd of September, 2020. So the first slide shows the epidemic situation for COVID-19 globally. So here the map, as seen from to the left, shows the distribution of COVID-19 cases by country across the world, and the darker blue colors indicates countries that have reported over 300,000 cases since the pandemic began. Seen from here, there are about 13 countries that have reported over 300,000 cases to date. The panel to the right is an epidemic curve showing the trend of COVID-19 cases reported daily by the 6 WHO geographic areas. So we are seeing that the Pau region in orange color is still reporting the highest number of new cases by day. Africa, here seen in the dark blue color, currently accounts for about 5.2% of all COVID-19 cases reported globally. So currently we have over 25 million confirmed cases that have been reported to date from 215 countries and territories, out of which over 840 have died, giving a case fatality rate of 3.4%. So this figure shows the distribution of COVID-19 cases by regions of Africa with a 7-day moving average. As of today, we have got close to 1.3 million confirmed cases that have been reported on the continent, and over 29,000 people that have died, resulting in a case fatality rate of 2.4%. Another thing colleagues to note here is, and quite important, is that close to about 1 million people have recovered from COVID-19 across the continent. So this table shows the distribution of COVID-19 cases, deaths, and recoveries by AU regions. So in the past day, close to 7,000 new cases and 231 deaths, and about 5,000 new recoveries have been reported from 55 AU member states. Of these, 44% of the new cases have been reported from the southern region, which also accounts for 65% of the new deaths and 56% of the new recoveries on the continent. So this slide just shows the trend of the weekly new COVID-19 cases in the past 4 weeks. So here we can see that 22 countries shown here in color green are showing a downward trend, while 9 countries in the deep brown color are showing an upward trend. So these countries that are showing currently an upward trend include Ethiopia, Rwanda, Uganda, Libya, Morocco, Tunisia, Namibia, and Burkina Faso. Okay, so then finally on the updates, this slide just shows the cumulative number of COVID-19 testing in Africa. So as of today, over close to about 12 million tests have been conducted on the continent with a positivity rate of about 11%. The test per case ratio for the continent is currently stands at 10%. As we know, the recommended test case per ratio is about 10 to 30. So this just shows how countries are conducting their tests. So I'll end here for the update, but Anne, if you allow me, I just want to brief the members on the course, the colleagues about, I think, the upcoming workshop that will be holding. So I'll just take colleagues through the activities that we've been conducting as IPC, TWG, and specifically the IPC logistic subgroup. So basically, the logistics subgroup of the AFCO TWG is supporting member states with building capacity. And I think one key area that we're looking at is the quantification of IP supplies. I think we know this has been a challenge in most member states. So to this effect, the IPC quantification trainings for member states has been planned for. So modules are being developed. So very soon, we will be calling upon member states to ensure that they nominate candidates that will be able to be trained in this. Furthermore, we are working closely with the NEPAD, where 8 epidemiologists have been recruited to specifically support member states in quantification of IPC supplies. Then one other exercise that the TWG is been jointly engaged with has been to map the producers of the personal protective equipment on the continent. And I think one of the issues that have come out in the process of this mapping is that there isn't domestic capacity to meet all PP requirements in the member states at present. Another thing was that new manufacturers are coming onto the market quickly in response to the local needs, and we need to ensure that we find ways of ensuring that whatever is being produced is of quality. Another finding was that existing manufacturers of PPE have limited routes to market through large-scale procurement mechanism. And the other one was that not all countries have good national standards that have the necessary skills to be able to accredit new producers. Another thing is that there is a very limited post-market surveillance of PP standards for products that are being imported and locally produced at the present time. And finally, we did find out during this exercise that there's limited laboratory testing capacity for new manufacturers to test and accredit PPE on the continent. So this is just a map showing the AU member states and PPE manufacturing industries, as I've earlier described. So I think from this map, very few countries are able to produce medical grade PPE. Okay, so due to this, the TWG actually saw a need to hold a workshop to promote local manufacturers of PPE to support the COVID-19 response. So basically, the aim of this workshop is to bring together stakeholders in African production of PPE to highlight barriers and solutions and support the development of domestic PPE industries. And of course, specifically, the workshop aims to create a forum for innovators and technical experts to share ideas and find locally relevant solutions. Another thing is to ensure that we share the best practices from PPE manufacturers and regulatory agencies that have already adapted to respond to the pandemic, and to also examine the issues in building Africa industry resilience to future health emergencies and shocks. And lastly, to share best practices in building institutionally integrated practices on the protection of health care workers with regard to access to safe and effective PPE. So in this regard, this workshop will actually hold on Thursday, 3rd of September 2020, that is tomorrow, at 1 p.m. That's East African time. This will be 12 noon, that's Central African time, and 11 a.m. West African time. And I think our colleagues on the call, we need to ensure that you share this widely in your networks. I think some of the speakers during this important workshop, we include the Honorable Nigerian Minister of Industry and Investment, His Excellency Adenai Adebayo, of course, the Director of Africa CDC, Dr. John Kekasong, will also speak during this important workshop, and the Secretary General of the African Continental Free Trade Area, also that's His Excellency Mr. Wamkali Mene, will also be able to be able to speak during this important workshop. So the link will be shared, I think, in the chat box. So please register to attend this important workshop. And as I said, can we share the link within our network so that as many people as possible join this workshop and see how we are going to promote the local production of PPE for the COVID-19 response and, of course, for future pandemics. I'll end here. Over.
Thank you very much, Dr. Patrick. And yes, I think it will be great if a lot of people can attend this workshop tomorrow. I just want to apologize if my internet's a bit unstable. We've got a terrible storm at the moment here in Cape Town. I just wanted to introduce our next speaker. If Patrick can stop sharing his screen after this for a few minutes, but let's leave this on so they can get the link. And her name, I just want to introduce her. She's Victoria Trinis, and she's a field coordinator for the CDC Foundation, working with the Waterborne Disease Prevention branch of the US Center for Disease Control and Prevention. Her work focuses on water, sanitation, and hygiene in healthcare facilities and schools in sub-Saharan Africa, and she's currently supporting the Community Mitigation Unit of the CDC COVID-19 International Task Force. So I want to welcome Victoria. I'm so happy that she was willing to share with us her time and also her expertise. So I'm going to hand over to Victoria to share a screen and then to start talking to us about her passion. Thank you, Victoria. Over.
Thank you, Anna, and good afternoon, everyone. Let me just get my screen. Can everyone see that?
Yes, we can see that.
Okay, great. So, so today I will be presenting CDC's consideration for COVID mitigation and response in schools outside of the US. We have not worked on any guidance for workplaces outside of the US, and so I will be restricting, and this talk will just be about schools today. So CDC's mitigation strategy for schools includes 5 main elements that, when combined, can control the transmission of SARS-CoV-2. These include maintaining physical distance, performing hand hygiene and respiratory hygiene, proper cleaning and disinfection, and conducting screening and monitoring. I will describe specific actions that can be taken within each of these areas. We also frame our control measures by the type of activity. And this includes personal controls, meaning individuals' behaviors that can protect themselves and those around them. Administrative controls, which are processes and policies that school administrations can put in place to keep people safe. And engineering controls, which we define as physical structures that can be put in place to distance people from hazards. As with the elements of the mitigation strategy that I mentioned on the last slide, these types of controls should be layered on top of each other to reduce the overall risk of transmission. Also, the examples that I provide today may be more or less relevant or feasible based on available resources and the state of the epidemic locally, and should always be guided by local policies. I'll start by describing some key personal controls across all of the mitigation elements. For physical distancing, students and staff should ideally maintain a 2-meter distance when possible between others who do not live in their household. I know in many instances this isn't feasible, and we'll talk about some other alternatives later on. For hand hygiene, individuals should practice frequent hand washing with soap and water, being sure to wash hands for 20 seconds. And if it's available, people can also use alcohol-based hand rub with at least 60% alcohol. For respiratory hygiene, students and staff should wear a mask, particularly when indoors and when maintaining a 2 meters distance from others is not possible. And people should also cover coughs and sneezes. For cleaning and disinfection, people can wipe down frequently touched objects and surfaces before or after they use them if disinfecting supplies are available. And for screening and monitoring, students and staff can monitor their own temperature, especially if they have symptoms indicative of COVID. And they should stay home if they feel sick or have been in close contact with someone who is sick. And I should note here that the CDC does not currently recommend universal symptom monitoring for schools in the US due to limited evidence about its efficacy, but the WHO does suggest considering this, and it may be more relevant in areas where there is limited testing capacity. And I know that other countries are requiring this for schools. So I'm now going to talk about engineering and administrative controls that schools can consider for each of the mitigation elements, starting with physical distancing. Some key administrative controls that can support physical distancing include restricting mixing between groups by using a cohort or pod approach so that students interact with a dedicated small group of other students to minimize spread if there is an exposure. Students and schools can establish an alternating schedule for these cohorts to maximize use of school space. Schools can also enact policies to limit crowding during the school day, avoid letting students share books and supplies, and restrict entry of caregivers and visitors to the school. For engineering or structural controls, school administrations can direct the flow of students in hallways and entrances so that people don't pass each other in the opposite direction. Classroom layouts can be modified so that there is greater space between desks, so that all desks face in the same direction and pupils do not share desks or tables, at least not within 2 meters. Also, visual cues or guides like signs and tape or chalk marks on the floor can help students and staff know where to stand, where to sit, and where to walk. The image here shows an example of how tape can be used to help space out desks. Some considerations and potential challenges for physical distancing. If there is a school feeding program or a cafeteria or canteen, food should be served in individual portions and not be self-serve, and students should not share plates. And also this applies to snack vendors that often serve food at schools, and schools may need to figure out how to make snack vendors safe or if they should still be serving. Also, if possible, schools should consider whether distance learning options or other adaptations are available for students and staff with conditions that put them at higher risk for contracting COVID. And if the existing classroom space is too small to allow for sufficient physical distancing, in addition to the alternating schedule for cohorts that I mentioned, other alternatives include moving classes outside if conditions allow, being sure to maintain at least 2 meters separation between students, or repurposing spaces like gymnasiums or cafeterias if they exist. Another option that may be more suitable or feasible in rural areas could be to build temporary low-cost structures like the one shown here, being sure to maintain physical distance. Moving on to respiratory hygiene, some key administrative controls include requiring masks for students, staff, and visitors, teaching students about the importance of covering coughs and sneezes and safely disposing of tissues, as well as the importance of washing hands after coughing or sneezing, and posting signs with images that remind people to wear masks and to cover their coughs and sneezes, being sure that they are suitable for the audience. An engineering control would be to increase ventilation and airflow by opening windows or holding classes outside. Additionally, fans can be used to bring in air from the outside. However, fans should not blow air from one person onto another. An important consideration here is that wearing masks may be difficult or unfeasible for some people. If wearing masks is difficult for young children, schools can prioritize times of higher risk for when children should wear masks, like while in more public areas such as hallways, entrances, or queues. Special considerations may also be needed for people with cognitive, sensory, or behavioral issues who may have trouble breathing or need to be able to read lips or see facial expressions. These considerations could include distance learning options or hosting classes outdoors or in places with increased ventilation to decrease the risk of not wearing a mask. For hand hygiene, administrative controls include teaching students and staff proper hand hygiene techniques. Schools can require hand hygiene when people enter and exit the school and/or the classrooms, as well as other key times like after coughing or sneezing, before eating or handling food, and after using the toilet. Schools can also schedule frequent hand hygiene throughout the day to establish norms and make students familiar with the practice. Schools should also develop a plan to ensure that soap and water or other hand hygiene materials are always available throughout the school day, and they can do this by designating a teacher or student to be responsible each day. Engineering controls for hand hygiene include placing hand hygiene stations at school entrances and exits, in each classroom, near toilets, and near eating and food preparation areas. Schools can employ proven behavior change principles to increase hand hygiene practices. One example that's shown in the image here is using nudges or visual cues like footprints and handprints that lead people to hand hygiene stations, which have improved hand hygiene practices in schools in the past. Considerations and potential challenges include the cost and availability of hygiene materials, and I'll talk in a second about low-cost hand washing station options. If there's no water on site, schools can try to work with the parent community to bring water to the school for hand washing. A note that people with disabilities might need assistance with performing hand hygiene properly. And also, although hand washing with soap and water is the least expensive option, using alcohol-based hand rub with at least 60% alcohol is also an option, although students should be supervised to make sure they use it properly. So many schools use basins as hand washing stations where students dip their hands into the water. And this is not recommended because there is a risk of contamination. Hand washing stations should allow for hands to be washed under running water and always have soap available, like at the station at right. And obviously these are the kind of plastic stations with taps are good options for schools that don't have a piped water supply. This resource, the Hand Washing Compendium, has great guidance and resources for setting up hand hygiene systems. And these include low-cost, no-touch options like the tippy tap shown here at right. Not everyone loves the way that tippy taps look. I have talked to school administrators who think that it's not, polished enough for their schools. But particularly in the current instance, this can be an easy to set up, easy to maintain, and a very inexpensive way to bring no-touch hand washing to schools during this COVID era. So the Hand Washing Compendium, you can find this online, or there will be a link available in this presentation when it's shared later. Moving on to cleaning and disinfection. Administrative controls include setting up frequent cleaning and disinfection of high-touch surfaces, such as railings, desks and tables, door and window handles, toilet surfaces, toys, teaching or learning aids, and any material that is used and especially shared by students. Cleaning and disinfection should be done at least once a day and between cohorts if the school is using an alternating schedule. Schools should also be sure that anyone responsible for cleaning receives proper training and that cleaners have written or pictorial instructions to follow. Engineering controls for cleaning include ensuring that cleaners have proper PPE. In the context of schools, this means at least masks and also rubber gloves, heavy aprons, and closed-toed shoes if they are available, as well as eye protection if the cleaners are dealing with chlorine or other chemicals. Considerations for cleaning include the cost and availability of cleaning supplies and access to sufficient water. If water is not available on site, schools should try to invest in simple water storage containers like the one shown here. Also, many schools have students do the cleaning, and while the more rigorous cleaning and disinfection procedures are being done for COVID mitigation, schools should consider hiring an adult cleaner or arranging for parents or other community volunteers to handle cleaning, especially if disinfecting chemicals are being used. I also want to note that CDC does not recommend spraying or fogging of disinfectants in schools or on school transportation. There is limited evidence that this kind of large-scale spraying is effective. And in order to be effective, disinfectants need to have sufficient contact time and coverage, which is difficult to do when doing large-scale spraying. There's also a risk of exposing people to the hazards of inhaling disinfectants, and any organic matter like dirt and trash would need to be removed before disinfectants would work effectively. If commercial disinfectants aren't easily available, CDC has guidance for making a chlorine disinfectant solution using liquid bleach or other chlorine products. And again, there will be a link to this resource in the slides that will be shared later. Screening and monitoring. Administrative controls include developing policies for students and staff to stay home if they have symptoms indicative of COVID, or if they have had close contact with someone with COVID. The school should identify a point of contact for students, parents, and staff to notify if they have symptoms or a positive diagnosis. The school should also develop plans for screening procedures for students and staff and what to do to follow up with people with positive screening results. Engineering controls can include setting up screening stations, ideally with no-touch thermometers. Again, although this is not recommended by the CDC for schools in the US, it may be more relevant in areas where there is limited testing capacity. Considerations for screening include being aware that students and staff may fear the repercussions of admitting to having symptoms, which can include fear of falling behind, fear of lost wages, stigma, or other consequences. And schools can work to develop policies to mitigate these effects so that people feel more comfortable reporting symptoms, like developing more lenient attendance requirements and making it easier for students to be able to follow along with classes from home. Also, if school-based screening is not feasible, schools can encourage students and staff to monitor themselves for symptoms and educate them on when to self-isolate. And finally, schools can encourage students and staff to seek testing when appropriate if it's available. So what to do if someone gets sick at school? It's important to establish policies ahead of time. This includes making sure that staff and families know to stay home from schools if anyone in their household have COVID symptoms, are waiting for test results, or have received a positive diagnosis. Schools should also make sure there is a reporting system in place with a clear point of contact for people to report to and a system to notify close contacts within the school. If there is a positive case or someone with symptoms at school, the first step is to immediately but discreetly separate the person. Any areas that have been used by the person should be closed for 24 hours for cleaning, and the sick individual should be advised not to return to school until they have met local or national criteria to stop isolation. Afterwards, schools should notify local health officials, staff, and families of the incident, including notifying staff and families of any closures or restrictions within the school. School administrations should advise the individual's close contacts within the school that they should stay home and monitor for symptoms per local or national guidance. And after waiting for 24 hours to reduce the risk of exposure to the virus, cleaning staff should clean and disinfect all areas that have been used by the sick individual. If it's not possible to wait for 24 hours, cleaning should be delayed as long as possible within that time frame, just for the risk of any airborne transmission. So finally, here are some resources that can provide more detail on considerations for schools. The first link is our guidance for schools in non-US settings. The other links are designed for our US-based guidance and should be adapted as needed. So thank you, and I'm available for any questions.
Thank you very much, Victoria. I don't know if there's any questions. I think I want to hand over to Wande, Dr. Alami, and she can then take us through because we've got a lot of time to answer questions. So let's open the floor over to you, Dr. Wande.
Thank you so much, Anna, and thank you so much, Victoria and Patrick, for walking us through that session. Just to introduce panelists with me today, I have experts, IPC experts from Africa CDC, from ICANN, from US CDC, Resolve to Save Lives, on my panel today. So please feel free to drop your questions. Please put them on the Q&A box, not on the chat box, so that we are able to address all of those questions. So fantastic. I think I will start with the first few questions that I'm seeing right now. Victoria, if you'd like to take this, it just says that, what is the suggested protocol for schools when they encounter suspected cases? Victoria, if you'd like to answer that, then I'll let other panelists to give some insights on that. Over to you.
Okay, thanks. So our recommendations are again, to isolate that person and close off the areas where they've been, to make sure that that person understands the local regulations about self-isolation at home, to inform their parents and their family, and to notify local health officials. And then, there are, in the links that that will be shared in the presentation, there's some information about contact tracing that schools can do. So trying to figure out who that student has been in contact with, and making sure that the families of those students have also been informed.
Fantastic, thank you very much. Anna and Prof, would you like to make more input onto that, or are you fine? We can move to the next question.
Thank you. I think we can move on to the next question.
So,
I don't have anything.
Okay, great, thanks. So Prof, since you're already on the, you have your mic on, this is just a case from Cameroon. This person says that the airport staff have been spraying chlorine on the hand baggage and check-in baggage of the arrivals. Is there any evidence to back up, say, spraying chlorine on the baggage or hand luggage of the passengers?
Thank you very much. No. I think it's still one of these things that we're dealing with. If anybody handles luggage, then do a hand hygiene afterwards. But I've seen it everywhere. I don't know if it's only Cameroon. It's been done in Nigeria as well. And it's part of this spraying everything around thing that we have going on. It's very difficult to stop it, but no, there's no need for it at all. And I don't think there's any evidence that it's really, well, what is most effective is breaking that, even if there was COVID on the, is to do a hand hygiene so that you don't touch your face. It's still going to go through the, it still goes through your nose, your respiratory tract. So it's more important that the virus does not get to your face or to your respiratory tract. So the answer in a short is no, there's no need for it. People can wipe it down, not spraying it, even if you wanted to do anything, wipe the handles and things like that. Thank you.
Thank you very much.
You.
I have a few questions which are really directed to Victoria. I'll try to put two of the questions together because they're very alike. So I think you had mentioned something around cleaning after 24 hours. So the question is, why should the cleaning take place only after 24 hours? And what the second question just goes on to say, what is the rationale for waiting for 24 hours before disinfecting? So over to you, Victoria.
Yeah, so the reason that we have that guidance is out of the concern, the fact that we still don't know how long infective particles can stay in the air. And so we recommend closing off the areas for 24 hours to reduce the risk to any cleaners of any droplets that may still be existing in the air. And that is, it's out of an abundance of caution using that 24-hour time frame, since we just don't know.
Okay, great.
And this is one day, if I may say, and please, I'm hoping that Prof will also jump in. that this is a little bit different than the recommendations in healthcare facilities, where we do recommend cleaning, of healthcare facilities at the end of each day or the beginning of the next day, and not necessarily to wait the 24 hours, because if you waited 24 hours between each person that you thought had COVID, you would almost never be able to keep a healthcare facility open. So hence, people in healthcare facilities, they have more access to the masks and, the cleaners, more access to the masks, to all of the PPE that's necessary for good disinfection in a healthcare facility and for also protecting themselves. So just to point out that there are slightly different recommendations for cleaning based on whether or not it's occurring in a community setting or in a healthcare setting. I bring this up because we have noticed some countries confuse sometimes some of our community setting recommendations, and they've applied those to the healthcare setting. And this has caused problems in that then the healthcare settings end up being closed for longer. And then the clinics get closed, and it means patients aren't being seen. So I just wanted to help clarify that. And I would love to hear Prof's opinion as well on that. Over.
Thank you very much. I very much agree with you. The recommendations in the community take into consideration the possibility, one, that you may not have access to the protective gear for you to use, and two, that you really afford in some settings to close down for 24 hours, but you cannot do the same thing in healthcare settings. But in healthcare settings, this is ameliorated by the presence of PPE. So in general, you can clean as often as you can safely. So if in the community space, you have the PPE and you can clean safely, why not? But we do know that if you close down, we know that the virus is likely to be, the concentrations will be diminished, so that if the people are going in to clean, they're safer. So it's always about safety and transmission. So in essence, I agree with you, which is what we do, but oftentimes people just read these recommendations and are not looking at the settings for which they're made. Thank you.
Great, thank you so much, Prof. and Elizabeth, for those very useful interventions and guidance. Karen, I'm just trying to see if Karen from Resolve to Save Lives is on the call, if you would like to possibly provide guidance on this. Just looking around, thoughts on transportation of students using school buses. That's like shared transport for students. If you would like to talk a bit about that and what we should be considering when this is being used. Over to you, Karen.
Pardon me. You were going to ask me that. I'm really not the expert in this field. I don't know what the CDC is recommending. Obviously, school bus transportation is going to be a bit of a problem. Without a doubt, students must keep their masks on all the time. How feasible that is, I don't know. It would depend on the age range. And obviously hand hygiene before, not to touch one another. I think this is a real issue, and I'd actually be quite interested to hear what Victoria says, or Elizabeth, and also what Prof says, because I think school buses, certainly in the United States, are key for getting kids back and forth to school.
The CDC's global recommendation for school buses for non-US settings is to clean and disinfect school buses before each shift, focusing on frequently touched surfaces, making sure that there's spacing between students, keeping windows open, and that both the driver and all the passengers should wear masks. And that is, and then not to do spraying.
Yeah, I would agree. Obviously, spacing is ideal, but that if you really expect the students to all go back to school, you're going to have to increase the number of buses or the number of trips, depending on the distances, and to keep students from fooling around on the bus, I remember my kids on school buses, it's going to be challenging.
Yes,
think
so,
Go
Elizabeth, are you?
Well, I was going to say, I think a key thing is something that Victoria said, which is masks and also really keeping those windows open as much as possible. Now, I recognize that in some areas of cities, there's so much pollution. You don't necessarily want to keep those windows open. But that being said, I mean, the blessing of much of Africa is it's not too cold in many of the places, so that you can keep windows open quite a bit of the year. Again, not during rainy season. But really, as much as possible, keeping those windows open, keeping as much natural ventilation as possible, I think that's going to help ameliorate some of the issues of the kids running around. I do hear you, Karen, about that. And then also keeping masks. And then we're going to have the reality of kids will be kids. I mean, it's the same thing going to be in schools. It's how can we, I think, in my mind, do the best risk reduction as much as possible, and that includes like the masks and the keeping things open, and what Victoria said, also disinfecting before the beginning of each shift, and potentially, if possible, having all of the kids and the bus driver wash their hands before getting on the bus. If there's a station, one of the stations that Victoria had, had shown all the different kinds of hand washing stations. I suppose one could also do that sort of at the especially the bus stop at the school before the kids get on the bus to go home. You could have a hand washing station, or sort of make sure all the kids wash their hands before getting on. Over.
Thank you so much, Elizabeth, Karen, and Victoria for that. Africa CDC, we have also been looking into that. I think just one other thing that we are looking to add on to is we're recommending that for school buses, for example, alongside ensuring that people wash their hands before getting on, use a face mask, we've also suggested that perhaps there should be like a plexiglass separating the driver from the back of the bus, and if possible, trying to use two different exit and entrance, such that they enter from the front and leave exit from the back. And we know that it might be difficult, but I think another thing that as the continent, many more countries, if you notice, is the considerations for other means of transport, encouraging use of bicycles, motorbikes to schools or walking and things like that, I think are quite important to things around transport of students. I think that's been fantastic. We will move on to the next question. Prof, if you'd like to take this, because again, from your experience across the sort of moving from like younger kids to much grown-ups in universities, this question just says that we know how it is in Africa. The hostels, the lecture theaters are overcrowded. What strategies should we adopt to keep the university community safe and conducive as we start to approach the new normal? Are there any key lessons that we should be looking at? So Prof, if you would like to answer that.
Well, let me first thank that person for giving me a question that's still giving us a lot of sleepless nights on how to approach this. The universities and the classrooms, there are lots of students, the hostels are overcrowded, and sometimes the problems are that there are very few reasonably priced accommodation outside the hostels. And I'm going to use Lagos because I think Lagos just typifies the places where you have the maximum problems. Housing is very expensive. Students really don't have too much choice to get accommodation outside the university. So we're doing, we've been thinking through this. The first thing is bringing back just the final year students. We're talking about making sure classrooms, we're trying to convert other spaces into classrooms. That classrooms do not take more than maybe 30 to 50, depending on their size, or even less. We're trying to encourage that all classrooms are both virtual and face-to-face. In other words, some students can stay in their own spaces and key in, so they don't all have to be in class. With all these we have not tested, and we're still working on that. That we would move some classes outside if the weather is good. They're all just these conjectures, all of it around reducing the students coming in. We're also looking at the possibilities that not every student will be allowed to stay on campus, and we know we're going to have a problem. And the problem really is that students will bring in their friends, whether we know it, and it's hard to police them adequately. So we're also trying to find if we can find more space outside, and that's a challenge, that students don't have to come and don't have to be on campus. So we're hoping that if we improve the hybrid classes, some of these students don't even have to come in at all. If we make sure that hostels are just for maybe the final year in such a way that there's only one person in a room rather than the usual 3-4 that we have. So we haven't sorted it all out. I'm not sure we have all the answers, but those are the directions in which we're looking at sorting this out. But it's going to be very challenging. I suspect that we're going to do everything. And I'm not sure we will still succeed. Thank you.
Thank you. I think this session is particularly interesting because we have to consider that many of the things and interventions we will be doing as a continent is not it's not the textbook approach. We have to be very context specific. We have to give considerations to the fact that our economies, our infrastructures are at various levels of development. So we have to be very innovative with our interventions as IPC experts and as healthcare workers. So very quickly, I'll be moving on to the next question. Elizabeth, if you'd like to take this. I think in the context of schools, now this is looking at environmental cleaning and decontamination for bathrooms and toilets. I believe that in the context of non-healthcare settings, that is schools or workplaces. So if you'd like to speak a bit about guidelines, frequencies around cleaning and disinfecting bathrooms as we are back to opening schools and back to opening offices.
Yes, thank you, Wande. And I have to say, I am not an expert in it. I'm more on the healthcare side. I'm going to defer actually to Victoria to talk a little bit more about schools. And CDC and I believe WHO also has not yet, well, maybe WHO has put out guidances for offices. CDC has not yet put out guidances for offices in non-US settings. So I don't want to really get ahead of CDC on that. And I'll defer to Victoria for the schools.
Yeah, so our recommendations for cleaning toilets is to clean and disinfect the high touch surfaces within toilets. So particularly door handles, toilet handles, if there's like a flush toilet, at least once a day. But I think more cleaning could be indicated depending on the use of the toilets, but that is what our recommendation is.
And obviously more if the toilet is visibly soiled, you know, or anything like that, there would be more cleaning recommended. And I think, Victoria, if I'm correct, it's still at the same levels of 0.1% bleed. Is that right?
Yeah, so that's the, if there aren't other nationally recognized disinfecting products, then we do, recommend the 0.1% chlorine solution.
Excellent. And the same principles in healthcare facilities would also apply for toilets and such in offices and in schools, which is first you clean using some sort of detergent and then disinfect. Again, very important to have those two steps there, the cleaning, which removes the organic material, and then the disinfectant, which actually helps kill any remaining sort of unseen bacteria that can cause disease. I think it's the same principles as one uses in the healthcare worker, as we as IPC professionals suggest in the healthcare worker, would also be in these settings, especially in settings like toilets where there is the potential, higher potential for disease transmission. Over.
And I just wanted to add in that, you know, in the healthcare space, the definition of what are high-touch surfaces. High-touch surfaces are well defined in the healthcare space. For schools, it's less so. And so I think it's important for school administrators, cleaners, and maybe prospective students to kind of walk through the school space and identify what are the high-touch surfaces that students and staff are touching throughout the day, and to identify what is what needs to be the target for cleaning within the toilet and within the rest of the school.
Yeah, and probably the easiest way to see it in school, I mean, I can even see it in my own home. The highest touch surfaces I can identify because they're like walls and places like that. They're the ones that tend to be the dirtiest, you know, for my hand. And I imagine in schools with kids touching and hands, it would also be fairly easy to identify high touch surfaces in that way.
Okay, great. Thanks a lot for those useful interventions. This question I will throw to Patrick and Mohammed. Thank you so much for sharing some of the work that we are doing as Africa CDC to support local manufacturing. But this question is really around, there's so many face masks now that easily snap, particularly in Africa. What are your considerations, for example, for local manufacturers? Is there anything that we should be knowing and looking around for this low quality face mask? I know that sometimes you buy this, you buy a pack and you notice that almost 50% will just snap immediately and you don't get to use it, you have to dispose it. So I would like to hear from our logistics colleague what we're really looking around and how we can further encourage good quality production across the continent. So Patrick and Mohammed, if you would like to talk a bit about that.
Oh, okay, thank you very much, Wande. Excellent question. You can see on the screen we are displaying a flyer that talks about a webinar, not a webinar really, a workshop tomorrow about promoting local manufacturing of personal protective equipment in Africa. This is exactly a response, Africa CDC and other partners' response to what Wande have just finished saying. First, we realized that at the onset and even at this stage, the involvement of local manufacturers of PPE in Africa is challenging. It's something, it's so low that we feel it's not sustainable. And considering everything we've been talking so far, we know that one aspect that COVID-19 has taught us is that we must continue to talk about infection prevention and control, not just among health workers now. We're really talking about schools, about universities, about office workspace. We cannot continue shutting down schools forever, and we cannot continue shutting down our economy forever. We have to open up, and open up we will do. Therefore, the demand for these PPEs will definitely increase. It will increase much, much more than we were used to before January 2020. Therefore, our local manufacturers of these PPEs in Africa must, as a matter of necessity, stand up, wake up, and begin to contribute to this new normal that we're having in the world because of COVID-19. Not just COVID-19, if you listen to scientists, they tell you it's a matter of time before another form of emerging and re-emerging infectious diseases will come up. So this workshop is to, number one, look at the challenges and gaps that we have in terms of involvement of local manufacturers of this PPE on the continent. And very importantly, as Yewande has pointed out, we have issues of standards, we have issues of regulations. All will be discussed during this workshop tomorrow. And this workshop will be graced by no less person than His Excellency, the Minister of Industry, Trade and Investment in Nigeria, and by the Director of Africa CDC, very importantly, His Excellency, the Secretary General of the Africa Continental Free Trade Area, His Excellency Mr. Wamkela Mene, will also grace this occasion, and we've lined up speakers, experts in the field that will hopefully draw up a roadmap for further involvement of local manufacturers and a way of creating awareness and market for these local manufacturers, so that we don't just depend on importation of these things to Africa, which will not be sustainable, will be expensive, and will keep them expensive for use in our often not so rich population. So this, we feel, is one of the most important work the IPCTWG is doing, and we are inviting everybody on this webinar to join us tomorrow to listen to experts from WHO, from US CDC, from UNICEF, from NEPAD, and in fact, including the African Medicine Supply Platform, a platform that Africa CDC developed to help member states in purchase of IPC materials for use for this pandemic and beyond. Thank you very much, Wande. If Patrick wants to add, Patrick, please go ahead and add a few words. Thank you. Over.
Thank you, Dr. Muhammad. I think you've excellently put, what the objectives and aims of the workshop is. Really, we really need to ensure that the local industries which produce PPE are encouraged within the continent. As you see, in terms of the global chain, the supply, most countries actually been affected in terms of trying to get these products. So really, the main outcome actually for this is to ensure each and every product that is either produced or imported, serious quality checks are going to be put in place to ensure that whatever we have is actually safe for our healthcare workers. Just to add a few words. Thank you. Over.
Fantastic. Thank you so much. I am really glad our participants are putting quite interesting questions that get us thinking. And I think this question, I'm going to open the floor for each of my panelists to speak a bit on, because there's really no hard and fast rule to this. There's no textbook way. Is that how do we then reduce stigma? As we are opening schools now and we test, some people are going to get infected. We know that is possible. How do we deal with stigma among school kids, among students? So I would like each of my panelists to talk a bit about that. I know that this goes beyond just IPC. It also goes into a bit of risk communication, mental health, and I'm glad we have some experts that work already on mental health and psychosocial support for the pandemic on the call. So if we can all each speak a bit about that, how do we provide guidance to parents, to school administrators, and to healthcare workers, and also policymakers around dealing with stigmas in schools following a positive test. So Mohamed, I know that you are the psychosocial expert here. If you'd like to talk a bit about that, then I will just move to the other panelists. Thank you.
Thank you very much, Wande. Yeah, I quite appreciate what you've just said, especially when you consider the effect of this pandemic on school children. I mean, it's one area that we often neglect. These children will be wondering what is happening. Why is everybody panicking? Why do we have to wear face masks? Why do we have to wash our hands? Why were we locked at home for more than, my kids have been asking me those questions. Why are we locked at home for more than 7 months because of a disease? This disease must be a really dangerous disease. And no thanks to the media, every day you watch, you see very scary things. People being moved from the wards. Everybody, the health workers wearing things that look directly from science fiction. So we really need to look at the effects, how it affects the children, and when they return back to school, how some of these measures that were excellently discussed today will affect their mental and well-being? And probably how will it affect their concentration in class in terms of being able to listen and do the primary objective of schooling, learning? So one thing we must try to do is to explain to these kids, to these children in the school, as plain as possible why these things are taking place, and explain as honestly as possible why they need to wash their hands, why they were away for 7 months, and the importance of observing all the things we've been saying. Schools must really learn to manage information, especially when it comes to issue of response to any potential positive case. And I think we may need to also do another series on maybe together with the lab pillar and the surveillance pillar. Hello, can you hear me?
Yes,
hello?
we can. Yes.
Yeah, together with the lab and surveillance pillar, the testing, what needs, how do you do testing in the case of a suspected outbreak in a school? And I don't know whether we touched it. I temporarily dropped out because of network problem, but if it was addressed here, that's okay. What do you do when a child presents with symptoms that are suggestive of COVID-19 in a school, and to ensure that we keep stigma attached to this child or to potentially any teacher or any worker in the school environment to as low as possible. So these are some of the areas that we really need to address, and schools should have a plan. It's not when they have a case or a potential exposure, then they start looking for what to do. Schools should have a plan on, as they are planning for the physical component, as they are planning for the IPC component, they should be planning on how to manage the mental and psychosocial component. We do have guidelines on that, the Africa CDC guideline, and I would beg somebody to put it on the screen before we close. I think WHO also has the guideline on how to manage mental and psychosocial issues concerning children. And the WHO have a website where they have materials on how children can express themselves in creative ways. And I think we will look at that and see if how we can contextualize it to the African context. Please, that as parents, as teachers, we must listen to these children. We must listen to their concern, no matter how stupid the questions look like, and we must try to get information to address their concern. The question, if you listen to them, they ask you very, very, very pertinent questions that we must, no matter how irrelevant it looks, provide information. The more you provide them information, the more you allay their fear, the more you allay their anxiety, and the more they can be able to at least learn in a conducive environment. So the key issue here is communication with the children, honest evaluation of the risk and allaying of their fear, and ensure everything is done to avoid stigmatization of any child because of COVID-19. We must not refer to children as having COVID-19 or a COVID-19 patient or something. So we must learn as teachers, as healthcare caregivers, and as workers on how to handle children and their specific needs. Thank you. Over to you, Wendy.
Fantastic. Thank you. I see how passionate we have all gotten regarding this, and I think it's been a long time coming. Elizabeth and Victoria, if you'd like to share some just insights around looking at stigma, and then I will move to Prof and Anna, and I'll move to Karen. So over to you, Victoria and Elizabeth from USCDC.
I leave it to Victoria. I'm more well-versed in the healthcare area.
And I am more well-versed in the WASH area and less on stigma. So I do think that I can see the value of making sure that children are aware of like the risk period and when risk ends, and you know, just so that they know that like once a kid comes back to school, if someone has, you know, had suspected COVID or a positive case and comes back to school, that that when they're back at school, they're safe to be around. I could see the value in that. Over.
Great. Thank you, Anna and Prof.
I can just say from my side, you know, when we're dealing with that, is we try to show the kids as well, you know, it's not just about being positive of how we handle that. And it could have happened to anybody. So we're trying to, when we work with them, even with them in our squatter camps as well, is to just give them on their level some education on, you know, what is really happening and what they can do. But yeah, it's always difficult. It will always happen. So it depends on person to person how they will react on that. Over.
I guess I think that kids follow the examples of the adults, and working with teachers and parents together and having them talk to one another would be key, because as Anna just said, it's going to be their attitude that's going to influence how the children respond. And as Mohammed said, they need to listen to the kids and figure out where are the anxieties coming from. The stigma usually is intimately connected with fear. And I do think that this is going to require ongoing discussion among the adults that the kids look up to. And it's not going to be easy, but I think it can be done. I just think there has to be some reflecting on how to get meetings to take place so that parents can express what's coming home from school with their kids back to the teachers, and teachers also can communicate with parents. I don't think there's a formula better than that.
Thank you so much. Fantastic. So I think we will just move to the next series of questions. This really is in line with what Prof had already answered around university accommodations. But I think a couple of people have then further raised questions to say, okay, for universities it's a different ball games, but how about boarding schools where the student must share accommodation and they don't have options for things like private facilities because it's just not available in secondary schools or high schools like we call it here. So Prof, if you'd like to touch a bit about guidance or considerations where we must give to schools where it's boarding or a shared living environments kind of thing. What are the considerations and what guidance should we really be thinking about for schools like that? Prof, if you're on the call, you're muted. So I think I would just throw that to Anna if you're happy to take it on behalf of ICANN.
Okay, what I can just say, Wanda, to everybody as well, is that, you know, we know it's difficult. It's not always possible to have all these separation happening, but I think education and like Karen also said, is to show that we need to talk to all the stakeholders, you know, the teachers and the people at the boarding schools, the family members, the parents and all of them, that everybody understands what is their role, because we need to remember that everybody of us got our own responsibility to take care for our own health. And I think if we can explain to the students as well, and making sure that the cleaning happening regular basis, that hand hygiene is available, that the kids understand as well how to look after themselves, to keep their space and why they're wearing the mask, the correct way of wearing the mask, the correct way of performing hand hygiene when you remove your mask, that type of thing. I think that's the only thing that we really can do, because it is difficult. Each situation needs to be looked at. But I think if we have this continuous ongoing education on their level, show them there's lots of infographics, there's lots of nice videos available on children's level, so they understand why we are asking them to do certain things. I think then we can get the buy-in. children are quite open if you talk with them and ask them, but not talk down to them. I think having some discussions with them so that they can also see what is happening and they can maybe give their input, what they think can be done. Like Prof also said, is, you know, if it's possible to have some of it outside, create bigger space, ventilation as well, that could also help. But yeah, I'm not an expert in schools as well, but I think that is what we from our side would suggest, is to just keep that standard precautions, like we call it as well, which should be everywhere at our own homes as well in place, if we can just recommend that. Thank you. Over.
Thank you very much. Just to let you know that we are live streaming on Facebook, and to our Facebook participants, we are seeing your questions and we will respond to them. So please keep your questions coming in from Facebook. We're having a look at that and we're monitoring that. So I think this question just really talks again about the concerns of many Africans, is that we don't have enough facilities, we don't have access to water. How are we going to reopen schools? So I know that Victoria did a fantastic presentation and gave alternatives to things around overcrowding and access to water. So Victoria, if you'd just like to talk a bit about that, for the people that are live streaming on Facebook and perhaps joined a bit late and missed that, if you would just touch a bit on that. Thank you, Victoria.
Thanks. So for if there are limited space, if there's limited classroom space, our recommendations are to try a staggered approach. So having, you know, one half the class in the morning and the other later in the day, to repurpose any additional spaces that might be available, such as gyms and cafeterias. And if there is space, to move classes outside if the conditions allow. And then in terms of schools that don't have access to water, you know, there are a lot of water scarce schools around there. And what typically happens is that children end up walking a long distance to go to a water source and to bring back water, which is generally not recommended because that means less class time for them. So particularly in this time, it could be a good opportunity for the parent community to get involved in figuring out how to bring water to the school from the households, so that there is enough water at the school for hand washing and for cleaning, and having some you know, water storage containers, jerry cans, very low cost options for storing water at the school can really help make sure that there is enough water to meet the school's needs.
Fantastic. Thank you so much for that. I'm just looking around. I'm seeing a lot of questions around disinfecting and cleaning. I know that we've talked a bit about that, but I think people still have a lot of concerns around when is the ideal time to disinfect, what surfaces should we be looking around. I think many of these questions must have come in right after we talked a bit about it. So colleagues on the call, please feel free to look at the Africa CDC website. We already have published an environmental cleaning guidelines. The guidelines also are available on the US CDC and WHO website. And just to say that we have a community of practice, which is a Telegram channel where many of us experts are also there. Feel free to please join this community of practice. We always put the links to this guidelines, to these publications, so that they're easy for you to use and easy for you to just drop your questions to be answered by our experts. So I think a few more questions that I would just like to for us to talk about. Anna, if you would like to take a go at this. Again, I know that in many of our webinars, this always pops up around the misinformation, the myth around how the use of face mask is going to affect people and the breathing of children. So I've seen a question that flags that as a concern. So if we can just, if Anna, you could just reiterate what we have always said, because we cannot just say this enough. We just need to keep reaffirming and reassuring people of the benefit of the use of face mask. Over to you, Anna.
Thank you, Wanda. Yes, I'll just want to re-inform that understand is the correct way of wearing the mask. You need a bit of and then also the type of material that has been used to, to manufacture this masks. Also, how to take it off and how to put it on. I think it's very important that children understand as well, and how long can you keep the mask on while wearing it. It's important that we understand that there need to be some sort of a break, after about 2 or 3 hours, to be able to have a breather for a few minutes and then re-put it back on. But hand hygiene in between as well is very important. The mask needs to be washed every single day, dried and ironed or exposed to heat if possible. So it will be, if possible, have 2 masks, so that you can wear the one day and the next one the next day, and then at least have the washing in between. So I think it's important for us to make sure that people understand that this, why we are wearing the mask, is to prevent you from getting exposed to, if people are around you, the droplets that could have been carried around, or if you are sick and you want to protect the people around you, that you don't expose them to the droplet exposure that might be happening. So that is for the community and for our children as well. But I know that Karen is also more expert on that, so Karen can also jump in if Prof is not on anymore. Karen, thank you.
Well, I agree with you, Anna. You can't say it enough, and mask use is critical. And I think, having watched this in New York City, there isn't any question that it works. And kids wear masks all over the city. There isn't any detriment to health. Whether young children will keep them on is a different question. But in terms of danger or fear, I don't think that's anything bad happening to you because you keep a mask on. They have to be properly made, of the right material, as Anna said. But I think that certainly in many Asian countries, they've been doing this for decades. And around New York now, I am continually impressed that people wear masks of all ages, including little kids in strollers and buggies, and there seems to be almost no issue. And so I think it's key, and we just have to keep saying the same thing. There are people making extremely attractive masks, if that makes it easier for the community to accept. But I would absolutely agree with ICANN and Africa CDC that wearing masks in the community is essential.
Great. Thank you so much, Anna and Karen. I think a few more questions that have really been directed to Victoria. It's around the monitoring and the screening. I think this person was a bit confused and wants clarity to say that in terms of do you recommend monitoring and screening? And there's another question around guidelines on identifying symptomatic or asymptomatic students and when you let them back into school. So ideally, what is the time to let children back into school once they have their negative test? So over to you, Victoria.
Well, as to that last point, I think, the US has its own standards, but I think every country is developing its own policies for when to end home isolation. And so I think that question would have to defer to whatever the country's policies are. In terms of screening, so for our international guidance, we follow WHO, which does recommend considering doing screenings. For the US, for the US schools, CDC does not currently recommend screening, and that's because of the limited, the lack of knowledge around children can be less symptomatic, and so it's not clear what symptoms to look for and whether having symptom screening is really going to be catching children who are positive for COVID. And so the kind of the cost benefit there currently, the CDC for the US is saying and is not recommending it for US schools. But that's also in the context of a place where testing can be somewhat readily available. And so in places where testing is not as easily available, symptom screening is one of the tools that that people have, and so it's a tool that can be used.
I think, yes, I believe that we have also published something around that, and that is available on the website. So I think it's been a really interesting and engaging session. I know that I'm trying to see if there are other questions that have not been addressed on the Q&A, because I see people putting some questions on the chat box, but unfortunately it's difficult to scroll. So please put your questions on the Q&A. We have a few more minutes. So I think this question really would be to you, Victoria, again, because you really talked about the schools, is that should there be any considerations for doing a quarantine or self-isolation in the school? So if you would like to answer that based on the guidelines that you have put out.
Sorry, I'm not sure if I understand the question.
I'm assuming that this person really meant to say, if, for example, I hope I'm doing a good job explaining your question, Nolene. Like if there was a case in the school, how do you separate the student until you're able to transport to a different facility and things like that, if you'd like to talk a bit about that.
Okay, so that, I think it depends on, that would have to be a policy that schools would develop depending on the space that they have. I know for other contexts, we recommend designating a specific area where people who have symptoms or suspected cases can be isolated away from others. So if there's a staff room or something, or some sort of extra space that is not being used by anyone else, then that could be designated as a place to isolate any potential cases. But again, that's going to have to depend on the physical layout within each school.
Thank you so much, Victoria. Fantastic. This is a comment, really not a question, is to just buttress our point around preventing stigma in schools. I know that this intervention has come from our colleague to say that we need to start encouraging kids to look out for each other. We as Africans are very family oriented. So looking out for each other as your brothers or your sister's keeper is the best way for us to re-emphasize or the IPC considerations and preventive or precautionary measures that students can adopt. So thank you very much for that intervention. I think that is something that we should look out for as parents, as teachers, school administrators, health workers, and policy experts as we guide schools and economies back to reopening. So on that note, I think I can hand over to Anna so that she can walk us through the social app and the final QR code for the participants to get their certificates. Thank you so much for joining me on this panel today from Africa CDC, experts from Africa CDC, experts from US CDC, experts from Resolve to Save Life, and of course, our co-host, Icon. Thank you for taking time to be a part of this. So over to you, Anna, to walk us through the last and final session for today.
Thank you very much, Wande. I just want to thank everybody, and I want to thank our speakers Patrick and Victoria for the great presentations they've done. Thank you for the panelists as well for the great assistance with all the questions and answers. And I just want to reiterate for all our participants, you'll have to download the social participation app, and we've posted the link on the chat box as well and on the Telegram of Community of Practice. Because if you've got the app, you'll just have to then scan the start and the end code. And as we said before, if you have the codes, then immediately you'll be able to get your attestation at the end of that. So you have to scan first the start code at the beginning of the session. And if you've got the app, in the middle button, it will ask you for scanning. You can start scanning then, and it will tell you that the session has started. And at the end, then you scan the end code, and it will tell you that you've got your attestation, and immediately it will show you the attestation. If you haven't been able to download the app, or if you are using your phone, it is going to be difficult. So it will be easy if you then have the Telegram of Practice, because then you can, after the session, just go open up the start and the end code on the Practice, and then you will be able to scan and still have the attestation for a few hours after the session. But each week have got their own codes. So unfortunately, you have to do it via the app. At the moment, it's not possible for us to send attendance certification for all the people because of the huge influx of participants. But if you do have a problem, please contact us by Africa CDC, via Susan or for myself, and we will see how we will be able to help you. So at the moment, I'm sharing with you the start code, and then here I'm going to show you the end code as well. So if you do want to just scan this, you will be able to get your attestation. And every week we will have different codes for each session. So please join us again next week. We'll be going to talk about dental practice and what is happening there. And Professor Shadai Ogunsola, our chair, will be the speaker. And I think it's a great way to be able to see what is happening in different departments. So please, we welcome all of you. And then for our French-speaking participants, there will be a French session, the same as today on Friday, which will be in French as well. So each week we'll have that. And as Africa CDC also showed you, it's live streaming on Africa CDC Facebook. And they are recording this as well. And we will be able to give you some of these slides if you need them. Please just contact all of us, and we'll see how we can assist you with this great need. Thank you, everybody, and have a good day.
Thank you, and bye.
Bye.
Thank you. Bye, everybody.